Hello everyone, good evening. This is Dr. Karen Sullivan with you with another I Care for Your Brain lecture. I am a board certified neuropsychologist and I am here to empower you with science-based brain health information and evidence-based recommendations. We have been meeting here for a couple months now, and it is very important to me that you know that you can tune in and find out real interesting, very valid scientific information that you can apply to your own recovery. What we are going to talk about all month in April is stroke and post-stroke recovery, and what are some evidence-based things that you can be doing that are affordable, that will genuinely give you a return on your investment, and will bring you closer to your maximum recovery. Remember, we're always talking about that recovery does not happen just in the first few months or the first year or the first 2 years. It is a never-ending, ongoing journey, and the more you put into it, the more you are going to get out of it. So what we're going to talk about tonight is mirror box therapy, and I wonder if there's any of you out there who have actually heard of this before. It's unbelievably powerful. It's amazingly affordable. It is simple, but yet we aren't really talking about it. We're not promoting it enough. So what I'm going to do tonight is tell you what exactly it is, how exactly you can get one, how exactly you can benefit from it, and all the research and everything that you need to know in order to make a good informed decision for yourself. This is must-know information if post-stroke you are struggling with two things. Anything to do with your hands or your arms, meaning you either have full paralysis in one hand or arm, if it's weak, if you have spasticity, if it's not working exactly like it did pre-stroke, you need a mirror box. Also, it's been shown to help in post-stroke pain syndrome. So that's what we're really going to focus on tonight. Mirror box therapy is so cost effective, you guys. It is less than the price of going out to a decent dinner with one of your friends, okay? It's amazing. I love it because it is so elegant in its design. It's based on a very complex neuroscience body of literature, and it's applying a very, very practical intervention. It has 100% no adverse side effects. It's hands down one of my favorite lines of research. One of the books that I read over 20 years ago that really inspired me to be a neuropsychologist was a book based on mirror box therapy by a neuroscientist researcher named Ramachandran, who's at the University of California in San Diego. And he's the first guy that came out showing that mirror box therapy worked. And he used it with amputees who had phantom limb pain. So I want to talk to you tonight a little bit about his research, but of course, how does this relate to stroke? How is it that it could possibly help you? So what we're going to do tonight is focus on the research that's been done. And the reason that this is so important is that we've made so many advances in stroke care in the last 2 decades. And that means more and more people are surviving after a stroke, which is great. But it's not good enough to just live after a stroke. We are all struggling and advocating for the highest quality of life, the highest level of recovery, and a high level of acceptance. Remember, that's one thing I'm always trying to tell you guys. Complete optimal recovery is not realistic for the vast majority of people. You're going to have to learn workarounds. You're going to have to accept that some things have changed, especially if it's anything more than a small stroke, which is a lot of you. And so we have to figure out what are the things that are actually going to work and are going to bring us closer to that maximum benefit. So one thing I love about it is you can do it at home. You don't need insurance to do it. Like I said, it's very affordable. You can use it for very mild, poor dexterity issues, all the way up to a very, very dense hemiparesis. So most importantly, when we talk about the research, though, it's not that it just gets you better when you're doing the therapy. It actually seems to last at least 6 months, if not longer. And then the idea is you just redo a little bit more of the mirror box therapy and you gain the benefit back. But very importantly, it also transfers to everyday life. And if you've watched me, you know that part of my criticism of the brain fitness industry is like with a brain game. that you get better at their game, but it doesn't mean anything in terms of the real structural recovery of your brain or your everyday function. You get better at getting that little turtle over the log and get him back home with his turtle babies. That's great, but we need to know, are you better able to tie your shoes? Can you feed yourself better? Can you get back to work? And that's part of what's so cool about mirror box therapy, is it actually shows transfer effects from the therapy to genuinely result in neuroplasticity in the brain. So since the 2000s, mirror box therapy has been available, but through very expensive programs like virtual reality and robotics. These expensive technologies aren't any more effective than buying a very affordable mirror box yourself. And as part of my preparation tonight for this lecture, I did a ton of research trying to find out who's making the best mirror box. I needed a portable one that you can take, this thing should get some wear and tear. You should really be using this. How affordable is it? We needed to know a lot of different information before I felt comfortable recommending one to you. And I'm really excited to tell you that I know I have found the very best one on the market. I have been in touch with the creator, and he has given us a code that I'm going to post in the comments section when I'm done to give you a discount. And when you hear how affordable this powerful neurorehabilitation strategy is, I think your mind's going to be kind of blown. So let's just talk about what the heck is it? You're saying mirror, you're saying box. Okay, initially used with amputees by this neuroscientist named Ramachandran. This was in 1995. Since that time, 2.5 decades of research has convinced us that this is a very, very valid intervention post-stroke. So what you do is you buy an apparatus called a mirror box, and basically the person places their good limb, their good hand on one side, and the affected limb into the box where you can't see it, and there's a mirror in between. And the idea is that you are moving as much as you can, and I'm going to share some research with you tonight that shows even if you don't have any movement in your hand whatsoever, it will still help you. But the people who seem to do the best, they talk about, kind of conducting a symphony, doing kind of like finger to thumb exercises. There's all sorts of different things you can do. Put your hand back and forth like you're clapping. But the idea is that you're seeing a reflected image of the good hand moving, and to the brain, it appears that both hands are moving freely with wide dexterity, and the unaffected hand is showing you what you should be seeing in the affected hand. Okay, this is basically artificial visual feedback, and we are tricking the brain. We are happy to tell the brain this little white lie because our brain then thinks that we have gotten our affected hand completely back. And over time, through a period of just a few weeks, this illusion basically rewires the map that we have of our body and our brain back to function, restoring the ability of the affected hand to work. It's really, really amazing. So I want to help you understand what is the actual science behind this. Part of what we say in brain science is, what is the mechanism of action? What is actually going on here? I mean, sometimes we talk about smoke and mirrors, and we're literally talking about mirrors in this case. So to understand how the mirror box really works, you have to understand how the brain takes input from different sensory systems and basically constructs a representation of the body in the brain. So we basically have our understanding of how our body is in space, how it looks, how it feels, through something called proprioception, which is just basically the feeling, like if you take your hand and you just kind of move it up and down, if you close your eyes, you can kind of just feel how that is in space, the weight of your hand, how it moves your shoulder, how it moves the rest of your body. We also get tactile sensation. We can feel when something is on us, right? Typically. And we also get visual feedback. We can look down and see that our two hands are here and they're moving back and forth and they're moving well. When we integrate all of these, we build representations of our own body and our brain, and we use this to plan our movements. We use this to decide what actions we're going to take. All of these inputs are critical to building this map, and we call this map the homunculus. And you might have seen pictures of this. It's kind of a funny looking distorted human figure on top of the brain. And what's really funny about it is that the way our brain is the way our body is represented in our brain is not the way we think our body looks in real life when you look in a mirror. There are parts of the body that are overrepresented. So what we call this homunculus is really based on two different maps. This is our somatosensory map and our motor cortex map. And they are both in the gray matter, that bumpy gray stuff on the outside of our brain. And the lips, the hands, the feet, and the genitals are over exaggerated. And what this means is that they have more brain cells than other parts of the body. This is why if you get a little cut on your finger, it hurts so bad, or if you get a little canker sore in your mouth, it kills, because you literally feel those things more intensely. Okay, and so we have to think about, well, how does this relate to stroke? Well, this brain map of our body is formed over years and years and years and years of feedback, right? So you've been looking at your body before your stroke with your two hands working perfectly well, and this is the map that you have in your brain. So what happens after we've had a stroke, after we've had an amputation, and all of a sudden we look down and we don't get that same visual feedback? All of a sudden you see that one hand is clenched up. One hand, as much as the brain wants to move it, it just can't make the hand move. Well, the brain does not like this. This gets interpreted as a threat. It's kind of like alarms go off, danger, danger. It doesn't look the same. It also doesn't feel the same. So our brain basically interprets this as bad, and one of the ways our brain gets us to pay attention to things that are potentially threatening is through pain. It gets overexcited and it sends all sorts of pain signals that are interpreted by the person as pain, and really it's just an alarm to try to get our attention. It's a way of drawing our attention to what is going on here. How can you solve this problem? So this is really cool. The map of our body image in our brain is not hardwired, okay? It can be changed, but it takes time. It can be a process, and you have to know exactly what it is you need to do. This researcher, Ramachandran, taught us that not only do we have one map, but his belief is that we have multiple maps built through the process of redundancy, which is one of the principles of how the brain is organized, that things are represented many different times through the course of evolution. So if you have an injury to one part of your brain, there should be another part of your brain that in some way can be retrained to take up that same function. Now that kind of exists on a spectrum, right? Some things in the brain are very specific, but a big part of the brain is able to be reorganized. And the visual feedback from the mirror box is one of the most powerful ways to reorganize your brain. It's neuroplasticity at work. So let me tell you about how this all got started with the phantom limb pain. So basically, after people have an amputation, a lot of them still have the sensation that not only do they still have the limb, but the limb is actually painful. A lot of people talk about it like it's on fire. So this is up to 50 to 80% of amputees talk about phantom limb pain. It can develop immediately after the procedure. About half of all patients say that they feel some pain within the first 24 hours. And about 75% of patients about a few days after the amputation are complaining of pain to the point where they want pain meds for that foot that is no longer there. Okay, so with mirror box therapy, this was the very first clinical group that it was used with, the frequency of pain went down and the severity of the pain, okay? So this is something that is usually, pain meds don't really do anything. I mean, there's people that actually get their amputations taken up more and more. So say first the foot came off, then maybe next time it goes up to the calf, up to the knee, because they're kind of chasing the pain. It's really a very intense thing. So Ramachandran wrote about this in a book called Phantoms in the Brain, and I strongly encourage you to read it. It really was a life-changing book for me. I absolutely loved, like I said before, the complexity of the science, but the simplicity of the intervention. I just thought it was great. So his hypothesis is that every single time the patient is giving itself the visual image of the arm that is working perfectly well, it looks, because in the mirror, that you actually have two arms that are working well, that the body over time gets a new image stamped into the brain circuitry, and this mismatch is unacceptable to the brain. And so over time, it integrates the two images and starts to rebuild the body map, this homunculus in the brain. Many studies have shown that this is very effective. One from Walter Reed Medical Center just in 2017 basically showed that they could take male amputees after mirror therapy from pain scores from a 44 out of 100 all the way down to 27. Before the research study, they were reporting 17 hours per day of pain. After mirror therapy, they were reporting only 7. And what they found were the results were about as good as they were going to get after 10 sessions of 30 minutes per day. So in 1999, some researchers started to say, well, if this works in amputee pain, why don't we think about it with stroke and post-stroke pain, spasticity, hands that aren't working too well. So what I want to do tonight is take 3 common post-stroke symptoms and tell you all the research that I learned about. How might that apply to you? And again, don't forget, we got to talk about how to get your hands on one of these mirror boxes. So we're going to talk about the whole range of paralysis in a limb, post-stroke pain syndrome, and visual neglect. So let me just tell you a little bit about the paralysis. So after a stroke, about 80% of people have some kind of upper or lower limb motor impairment. So this can go all the way from full paralysis to my hand is just clenched. It just feels like it's a little weak. It's slow. It's tight. About 80% of people who have mild paralysis get full function back. Yay! But only about 20% of folks who have a really, really, really dense paralysis get their function back. Of the people who initially had difficulty with an upper limb, we think about half of them do pretty good over time as compared to people who have lower limbs. That seems to take them a little bit longer over the same amount of time to recover. So this really matters though, because people with lower limb impairment have a much higher burden on their everyday functioning. So this is, trouble walking independently, trouble, ambulate. You have a higher fall risk if you're not steady on your feet. So, that's something that we really have to think about. One thing that's really important to know is that it's suggested in these studies that this isn't one of those stroke interventions that we need to do ASAP. So many times we get this beat into our head that post-stroke interventions have to be immediate. There's actually research to suggest that you want to wait at least 4 weeks after a stroke to work on mirror box therapy. So what are the traditional ways of getting function back in a hand? Well, what we know is that we want to focus on practice, 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 and using the hand over and over in a variety of different ways. So one of the things that is most common is constraint-induced movement therapy. Maybe you've heard of this, where they actually tie up your good arm. And if you have some function in that affected limb, they force you to use it many, many, many hours a day. Some people even say 24 hours a day is most effective. But can you do this if you have very severe paralysis? No, you cannot. We also know that we can stimulate the muscles electrically. We can do passive and assistive movement stimulation. I love that when I see people putting massage oil on their loved one's hand and just making sure that we're getting the muscles, a little bit more exercised. So within the world of chronic pain syndromes after stroke, about 50% of people experience pain in their upper extremity in that first year, especially shoulder pain. And what they call this is complex regional pain syndrome. And there's 2 kinds, 1 and 2. 1 is what you guys have out there with a stroke. And basically it's pain that lasts greater than 6 months. It's considered to be a chronic neuropathic pain disorder. And mostly it seems to affect one limb. Usually people are, it's kind of a combination of it just feels like pins and needles and I can't use it quite well, but it also is really, really, really painful. Some people also have overall all body pain. Pain after stroke stinks. It makes you be unable to really participate in life and to function and do the things that you want to do. On a stroke support group on Facebook the other day, I saw an absolutely beautiful woman who is able to work, and she goes out and she shows the world this brave face, and then at night she comes home and she was totally distraught because of the chronic pain she has from stroke, and she wanted people to see that, and it was a really brave and beautiful post. But as we all know, pain affects your mood, right? This is one of the things I love about being a neuropsychologist is I'm balancing what happened to the brain, but how does it affect the person? Chronic pain is a big deal. It really wears down your wick every day. You have no choice really but to be irritable because you're totally overwhelmed by just trying to cope. So it's a really big deal that we figure out how to make advancements in the care of post-stroke pain syndromes. What are the typical ways that we treat this stuff? Well, heavy duty pain medications, opioids, Botox can help to some degree, but really a lot of patients I see, there's almost this feeling of like, you're just going to have to deal with it. You're going to have to live with it. So anything that I can teach you about how to reduce pain after a stroke is truly my pleasure. The next thing I wanted to tell you about was visual neglect. This is a disorder of visual perception and attention that is not due to trouble with the eye. It is a vision problem due to the brain. Many people who have a stroke in the right hemisphere of their brain, the right side of their brain, seem to ignore parts of space on the left. And these folks, usually about 40% of these people go on to have some kind of visual neglect. And you can see this in the hospital if you go to visit someone, like a woman only does half of her face in makeup, a man only shaves a half of his face. You look on someone's plate after they eat dinner and there's only half of the food that's eaten on one side. Those are pretty extreme, but we see this a lot when we do testing as neuropsychologists. People just aren't paying attention to kind of like one circle in space. And it's not that they can't see it, it's that the brain just isn't drawing attention to that part, it's just ignoring it. We know that neglect is a bad factor for recovery because we know that it keeps people from driving. It can increase falls, which, you don't need a traumatic brain injury on top of a stroke. The traditional ways that we treat it are just trying to enhance people's awareness, visual training, just saying, look left, look left. You always have to be kind of overcompensating. We have occupational therapists that help us with mirrors and prisms, and we can kind of do like a top-down compensation. So those are the three things. Now I want to tell you, what does mirror box therapy do for those three things? Well, there is something really cool out there called the Cochrane Review. And what these guys do is they take all the best quality research studies and they put them all together and they figure out, okay, with this powerful information, these are the highest quality research studies, what do we know about a specific scientific problem? Well, guess what? Last year they came out with one called Mirror Therapy for Improving Motor Function After Stroke. And it's 190 something pages. And that's a lot of what I did last weekend because I wanted you to know, as I always do, what does the research say? There is too big of a gap between the world of brain science and what gets communicated to the general public. And I see myself as kind of a translator between those two worlds because there is very valuable information for your recovery, your quality of life, your peace of mind over here. But you know who's reading about it? Other academics in their ivory towers. And so I wanted very much to have you, beyond the patients I see in my practice, benefit from this information. So what they did was they included 62 studies looking at a total of 1,982 participants that looked at what happened to folks after stroke who had mirror therapy versus those who didn't. People in this study were on average 59 years old, and they range from 30 years old to 73 years old. Mirror therapy was given 3 to 7 times per week for anywhere between 15 to 60 minutes. That is really nothing. And when I tell you how you do mirror box therapy, you're going to be like, oh my gosh, I could do that while I'm just sitting around on the couch. So one thing is 100% no adverse reports, okay? No one's getting a headache from doing mirror box therapy. No one is, getting diarrhea from doing mirror box therapy, okay? The strongest evidence that we have is that it helps in those motor symptoms, in anything that is going on in terms of the paralysis of the hand. We know that it specifically helps increase people's ability to grasp, okay, their ability to have dexterity with their hand, to move their arm and hand around, speed, how quickly they can actually do things with their hand, and also range of motion. That's one of the coolest things with the mirror box. If you watch someone whose hand was previously really tight, right? And so imagine that's in the box and this hand out here is doing all sorts of things. But remember, through the mirror, what is your brain seeing? It's seeing this, right? So people take their hand out of the mirror box and literally the hand is more relaxed. And over time, you can actually see people open up a hand. It's so cool. So one study that came out of Spain in 2016 showed that in stroke survivors with very severe paralysis, that they were able to get back more sensation. So the worse your paralysis is, I think it's going to be harder for you to get the maximum benefit, but still, if you can get back the sensation of someone at least touching the hand, wouldn't you rather that than nothing? Mirror box therapy has been shown, like I said before, to transfer to activities of daily living. More people who use mirror box therapy can feed themselves, can bathe themselves. And what we think, like I said, is it lasts about 6 months, and when you feel like it's not working as much, you just go back and you break out the mirror box again and you get back to your therapy. I also think, even though this has not been studied, that there are probably psychological effects to mirror box therapy. To be able to look in there and even for 30 minutes be able to feel like both of your hands are working, that's powerful, powerful stuff. So how does mirror box therapy work on pain? Well, there's definitely evidence there, but it's just not quite as strong as what we see for the return of function or of movement of a limb. So within that complex regional pain syndrome, what we see is that there is some evidence. People report that they actually have less pain. They have less pain intensity. So in one study where people did it for about 4 weeks, what they found was that people's recovery improved of the hands, the wrist specifically. People, they had little faces that had different kinds of pain expressions on them. People reduced their endorsement of how much pain they were experiencing. And the physical therapist who evaluated them said that they had better, what we call FIM scores. So FIM scores are these basic indicators of the severity of a disability. If you were in an inpatient unit recovering from your stroke, people were FIMing on you all day long and showing how you were improving as a result of their treatment. So when we think about visual neglect, this is the toughest one, but I'm not convinced that it doesn't do anything. It's just that the research hasn't found it yet, because visual neglect in general has not been a very robust area of recovery in the stroke literature. Okay, there's a very strong need for more well-conducted, larger scale, double-blind, placebo studies of how to actually help people with visual neglect. So when you look at the reviews, what they say is there's definitely no sign that it's not working. We just don't have good enough well-designed studies to say that it actually is working. But again, my question to you is, if you have an option of something that's accessible and very affordable that you can literally do at home in addition to all the rest of your therapies, of course you should be giving it a try, right? So within the world of visual disorders post-stroke, what we really think is that people need very individualized interventions. Now this does go in, personalized brain health care is what I'm all about. That's why we're here together, right? We all want our doctors to know our specific situation, to care, to give us evidence-based recommendations. But I would venture to say that the world of vision and stroke is one of the wild wests. It's something that we need in general much more research in. So I want to give you my conclusions. Okay, I think that mirror therapy is probably the strongest evidence-based intervention that you can do for treatment of paresis in your hand or in your arm. I think it also is very strong as it relates to a chronic pain syndrome. It has to be an additional intervention, what we call an adjunct therapy, right? In addition to what you're doing. This isn't the kind of thing where you're just going to do mirror box therapy and you're going to say, oh, well, I don't need to go to PT, physical therapy, or, I don't need to go see my counselor, or, I don't need my medication to help me with my depression. No way. This is really for people who want to do it all, because as much as you put in is as much as you're going to get back in your stroke recovery, okay? So the question is, even if this would help you 10, 20%, wouldn't that be worth it? So to me, it makes it a no-brainer based on the promising research and how very accessible and affordable it is. So remember at the beginning, I told you guys that I did all this research and I found the Primo mirror box. Well, it is from a company named Edge Mobility System. They are normally $79.99, which is actually ridiculously affordable for something this powerful. They have it on sale for $64.99. I have been emailing with the owner of the business, Dr. E. He is a neurophysical therapist. How cool is that? He's a doctor of physical therapy, and all he does is think about the connection from the brain to the body. He is all about empowering people with education, teaching them how to get out of the doctor's office and take control over their own health. And we love that, right? So he has actually given us a coupon code where he's going to give you another 10% off the mirror box. Okay, so this brings it down down to $58.50, okay? They ship it within a day or two. It definitely fits a hand, an arm, or a wrist. Little small feet can go in there. He is able to order bigger ones if we need it for, if you wanted to put, more of like a whole calf in there. And what you're going to do is you're going to put this mirror box on the table, put it on the couch, and you are going to put your good hand right here and your bad hand goes into it. And basically we're going to teach you how to do different exercises to get the most out of it, to rewire, to remap your brain. 3 to 7 times a week, anywhere from 15 minutes to 60 minutes, is going to enhance your recovery. We know that everyone's stroke is different because everyone's brain was different from day one and everyone's injury is different. So we really can't promise everyone will have the same results, but I think within 2 to 4 weeks, especially if you are struggling with any type of weakness, difficulty optimally using one hand, please, please, please consider getting this. I want to recommend to you some other things to enhance your use of the mirror box. And also when I'm done talking, I'm going to put that link to get the mirror box discount code in the comments section. So here's what I want you to do. Get the mirror box. Use the mirror box, and I want you to use it before bed, because remember we've talked about the power of sleep on memory and soaking up the benefits and the lessons for the day. This is very true with motor memory, with muscle memory. So you're going to get the most out of your mirror box therapy if you do it every night before bed. Okay, because when you are sleeping, your frontal lobes and your memory centers are playing videotapes all day long, home movies of what you did during the day. So you literally will get extra therapy 2 for 1 if you do it right before bed. I also want you to have calming music and to do your deep breathing while you're doing it. Really focus on bringing other parts of mental imagery into the therapy. Imagine your hand working again. When we imagine things, our brain is literally firing as if we are getting the use of that hand back. So the more imagination you can bring into your therapy, the more you are going to get out of it. I will see you guys April 10th with another stroke lecture. We're going to talk about the only diet that slows post-stroke cognitive decline. April 17th, we're going to talk about how to do your best to prevent another stroke. I know a lot of you have anxiety about having another one. And April 24th, we're going to talk about post-stroke depression, very common, and it can really, really interfere with your ability to engage in your rehab and get the most out of it. So I will see you guys again next week. I hope that this was helpful for you. If you know of any stroke groups where you want to share it, that would truly mean a lot to me. I do these lectures free because I believe very much in people having access to science-based brain health information, and I only want you to be going after treatment strategies that are actually going to work, okay? We don't need you falling for any too good to be true claims. We really need science-based, personalized brain health care. So when I get done, I'm gonna post that link for the mirror box therapy for you, and I would love to hear about your experiences with it. Thank you guys so much for being here, and I'll see you next week. Bye-bye.